And welcome back. Let's head right into the KUAM News Zoom room where we have the Chief Medical Officer for the Department of Public Health and Social Services, Dr. Bob Leon Guerrero. Doc, thanks for joining us. Good morning.
Good morning to you guys.
Well, we invited you onto the program because we wanted to help spread awareness and information about the booster shots. Now, all three available on Guam. So let's start with Moderna and who's eligible.
Okay, so they're basically all the same, whether it's the Pfizer, which was available a couple weeks ago, Moderna, and the Janssen that was available just a couple of days ago. So anybody that's 65 and older, we really, really encourage them to get the vaccine because they're more at risk of having serious complications with COVID. Those that are 18 to 64 with health problems, especially diabetes, and then those with jobs that make them at high risk by being in contact with multiple people. So those that work at centers and where there's a lot of people around.
And what about the Johnson and Johnson?
It's yeah. When I say Jensen, that's actually the company that makes it. So it's the Johnson and Johnson.
Is
all
that
three are available?
But that's 2 months, right? Isn't that 2 months? And then
with the Jensen, yes, the last dose has to be more than 2 months away. With the Pfizer and Moderna, they recommend at least 6 months.
Doc, I mean, I know the eligibility criteria, it's pretty wide, right? And we cast a wide net. I know with the intent of trying to get everybody to get this booster. But what if you're an 18 to 64-year-old who, let's say, you don't have a job where you come across people and you don't have a pre-existing medical condition? Would you still recommend that they get the booster?
Well, see, the idea of the booster is to help with those that their immunity might be waning, and that's why it's called a booster, to boost up their immune system so that if they do get exposed, they don't get infected. We're pushing the people that are at risk because they're more likely to have issues with COVID, meaning hospitalizations and God forbid, deaths. So that's why we're pushing for that particular age group, and with those with health problems. And again, those, which basically, I mean, most people live in a family of 10 in the household. So they're kind of like already in that recommended age with health issues and also being at risk for being exposed. So that essentially covers everybody on Guam that's 18 and above.
And what about homebound vaccinations, a booster program? I know that the mayors have partnered with public health for the village booster clinics, but there might be those Manumco, right, that can't go. So what program is public health offering to ensure that they get the booster shot?
Sure. Public health has a program where they actually go to the people's homes they get the names from the mayors, because they get the names from the mayor's office on those individuals that are homebound. And so like the clinics are Monday, Tuesday, Wednesday, and Friday in the morning, except for Friday in the afternoon. And then what the nurses will do after the morning clinics, they're usually going homebound to administer either the first or second or the booster or the third shot. So this is an ongoing program ongoing program since the very beginning. Actually, in the very beginning, we were very strict. We had to have a physician involved, and I ended up going with the homebound to different places that I never saw before in my life. So yeah, we've had this program ever since we started giving the vaccinations.
One thing we used to see was the deployment of these rapid engagement teams to those communities that don't really come out to the clinics and things like that to get tested. Are we also going to see that kind of ramp up for these booster shots or even vaccinations?
Good question. Again, with the availability of all these clinics by public health, the one at the mall and the one at UOG, you know, we're not seeing as much as we used to. So having special programs to vaccinate whatever groups probably wouldn't be a good usage of time and personnel. Just like the monoclonal antibody clinic, there was a talk about opening one down south, but in the beginning, there's like usually around 20 to 25 people engaging in that program. Now it's down to about 10 to 15. So, we're kind of stretched thin as it is. I mean, the nurses are nonstop going from clinics, going homebound. So to try to initiate a program where we try to go after specific groups with the availability of clinics all over the place, and especially, look at the mall. A lot of people end up going to the mall. So, it's there, it's available. And so I think we should just continue to maintain that until, we don't need to.
Yeah. Doc, again, you're pretty, I know you've been in public health a long time, a lot of experience, but new to the chief medical officer position. So the discussion on the booster shot, this has been a conversation we've been having for months. And obviously first it was Pfizer. And we've had a lot of time to prepare for the rollout of this booster shot program. And now that it's opened up to Moderna and the J&J vaccine, how would you rate public health's rollout of the booster shot program?
I'm part of the program, so obviously I think it's a good program, and I think they're doing what they're supposed to be doing. So I think it's great. I think it's good.
What do you have to say to people like Chris? He's the baby when it comes to getting a shot.
Yeah, actually, Doc, Sabrina is a big baby. She's already asking, like, are they using the big needle for the booster shot? Doc, and people, there was some hesitancy because people who got, especially Moderna, right? We're Team Moderna in here. A lot of people got ill after the second shot, right? So do you have any idea what people can expect when they get the third shot?
Well, with the third shot, first of all, it's not the same dose. It's half the dose of what the first two doses were. And part of that is that, you're trying to stimulate the immune system. And with the third dose, what you're trying to do is just remind it, just kickstart it. And so, it's like a moving car. When you first start or a car that's stuck, when you first start pushing the car, it's really hard. You got to apply a lot of force. But once it starts moving, you don't need to push as hard. And so in a sense, that's what's happening with the Moderna. It's when it first started, it's, you want to stimulate the immune system as quickly and as hard as possible. But then once it gets going, then it doesn't take as much to continue that push. So the Moderna, it may have been an issue with the second dose, but I don't really think, I'm not the one that received it, but I don't really think it's going to be as bad because, again, it's half the dose.
Right. Mm-hmm. What's your advice on the cross dosing?
Well, Europe has been doing it for several months. They were giving the AstraZeneca, then they would give Pfizer and Moderna. They gave whatever they were able to give. And so looking at their data, it looks like it might be a much better thing to do to mix. But, you're going to get good results whether you stick to the Pfizer if you got Pfizer from the beginning, or Moderna if you got Moderna from the beginning. So what's 1 to 10% more? It's still a good vaccine. It still can prevent major disease, whether you mix or use the same. So I just tell people just use whatever you can get.
What about people who recently got the flu shot, the flu vaccination? How soon after can they get the booster shot?
Uh, okay, so from the beginning, we were saying you need to separate the shot, any shot, with COVID shot by 2 weeks, because we didn't know whether if you gave it at the same time that you will have a problem. So now the studies are showing that you can give both the flu shot and the COVID vaccine at the same time with no major problems and good antibody response. And that's what people thought from the beginning, but they didn't have data to say that. So now they do, and I guess if you're going to get a shot and you don't want to get both, I'd wait at least 2 weeks between them. But you can get both at the same time.
Okay.
Doc, how crucial is this booster shot when we talk about exiting this 14-week surge that we're still in? I mean, do you think that this could be the so-called silver bullet to get us out of this mess?
Well, you can look at what happened with the measles vaccine. For a long time, it was only one dose, and you got a response of about 90% effectiveness. And then we had outbreaks in colleges with people who had the first dose. So that's where they came out and said, "Oh, it looks like we probably need a second dose." So we went from 90% to about 98% response with the second dose. And so the booster, most people will have antibodies, but the booster helps maintain that antibody level. So the higher the percentage of people that are vaccinated and maintain the antibodies, the harder it is to spread the infection. This Delta variant threw a loop to everybody, because prior to this, the contagiousness of the COVID was good, but not that great. But the Delta was a lot more contagious, and it was looking for people that weren't vaccinated, people that were vaccinated, but there was about a 10% failure rate, and then there's also looking at the people that were vaccinated, had antibodies, but then started waning. So it was very good in finding those particular people, and that's why we had the surge. So with the booster, it will help with those that had waning immunity. So if they got 2 doses, they still can catch it, because after several months, it's just like the disease. The disease, after about 3 months, you started seeing people get it again. Yeah. So the immunity from the natural disease, which is normally a lot better than the vaccine, was already waning after about 3 months. So, and that's why they decided, well, maybe we should also give the booster if the natural disease is also showing some problems with second infections.
Right. So yeah, Doc, I seen that data too. So it was 3 months between COVID infections, and then Dr. Anna put out data saying that the average time from second shot of the vaccine to COVID infection was 4.5 months. So my question is, how long is this booster shot going to protect people who receive it?
Good question, and I don't think we have a real good answer as of yet. My feeling is that this is going to be like the flu shot. You need to get it every year, but again, until we get the data, and they're still studying. They're studying it in Europe. They're studying in the U.S. Until we get the data to suggest that we need it every year, or we don't, we maybe need it every 2 years, it'd be just a guess, and I'm not very good at guessing.
Well, let me ask this then. So we saw the vaccine rollout. It went from encouraging people to receive the vaccine, even through the use of raffles, as I'm sure you're aware. And then it went from encouragement to mandating it. So with the booster shot, right now we're in the encouragement phase. Do you anticipate that this could be something that the governor attempts to make mandatory through executive orders similar to the vaccine mandates that we now have in place?
You know what? I really don't have an answer for that. I think you need to probably ask the governor about that. Again, the data coming out is very suggestive that the booster is needed for those that have waning immunity. And so just like the measles shots have been in the past, where it went from 1 to 2, maybe with the booster, then that's it. I don't know. And making it a mandate, again, I don't have the data to come out and say, yeah, I think that should be done. I mean, my personal opinion, I've been in immunizations for a long time with public health. And I can see the definite benefit of getting immunized. And I know there's people that who, they read things and, they don't want to get shots. They think, so many different reasons why. And I just see the benefits. I mean, all you have to do is look at what happens with the vaccine right now. Yes, we have breakthrough infections, but if you look at the overall rate, it's lower than those that are unvaccinated. And then if you look at the deaths, I mean, you're looking at maybe if 1 out of 60,000 people will die if they got vaccinated, then you're looking at what, 18 out of 30,000. So, I mean, I don't know about you, but I'd rather face the 1 out of 60,000 than the 18 out of 20,000. But everybody has choice, and we have to respect that. But as long as your choice doesn't affect other people, then when it does start affecting other people, that's when I kind of put my foot down.
Mm-hmm. In the guidance, it's 6 months after you complete your second dose of the 2-dose series, right, for Moderna and Pfizer. But what about if there are individuals out there that want to get the booster shot and maybe they have some sort of underlying health condition and maybe they got it like 4 months ago or 5 months ago? Would they be eligible to get the booster shot?
I mean, we have guidelines, and that's what it is the guidelines. It's not set in stone. Yeah. I mean, if somebody came up to me and asked me and has underlying health issues, it's immunosuppressed, and I would probably give it to them. But again, this is just the guidelines. It's not something that you have to do it this way. It's just, again, CDC's guidelines are just you should try to give it around 6 months. Have I seen it done earlier? Yeah. Again, with the 2-dose, you do have a very good response, whether you're immunosuppressed or not. But I point out to the measles, 90% effective. But then there were outbreaks in colleges, so they gave the second dose, and it was 98% effective after the second dose. Most people would be protected with just 1 dose, but to try to catch as many people, that's why they gave the 2 doses. So giving 4 months apart or 5 months apart, I wouldn't say no to the person, but the recommendation is 6 months. And with Jensen, it's 2 months.
Okay. And speaking of the Johnson & Johnson vaccine, we know that the inmates over at the Department of Corrections, they primarily receive the J&J vaccine. Is there an effort by public health to administer the booster shot? Yeah, over at DOC with the J&J.
I'm pretty sure there is. I just don't know the details though.
Okay. What about preparations to roll out vaccinations of the 5 to 11-year-olds? Doc, I know that FDA are going to be looking at that first week in November, but have we begun maybe drawing up plans?
So first of all, the way it's going to work is that the FDA is going to probably meet in the 29th, which is a Friday. Yeah. And then the CDC will meet probably the 2nd or 3rd, which is a Monday and Tuesday. So in anticipation to that, they sent out word out that start ordering the vaccines now because it's a different dose. So public health, the immunization program has already made the request for the maximum amount that they can receive. Whether we get that or not, we're not too sure because we never know what we get until we get it. We're already sitting down with GDOE about how should we start this vaccine program for the 5 to 11-year-old so that we can maximize what we get, maximize it to the kids that need it the most. And, just like the flu shot for kids, most kids don't get major problems, but they're the ones that can spread it. So if we get the 5 to 11-year-old, get them the shots, that's the amount of people on this island gets to be higher. And then maybe we can, be like the flu that, yeah, we get it once in a while, but we don't have to, have all these restrictions, and yet realize that we are going to get a few here and there. But if we get most of the people immunized, and I mean above 80%, I guess, I think we will be fine. But yeah, but we are sitting down with DOE about how to try to maximize what we get.
How are we doing with, the booster shots? I know that we've only seen almost 8,000 of the Pfizer booster, and then 299, at least this was in the latest CHIC report, for Moderna. Are we on a good track, or were you guys anticipating, man, we should have more people boosted by now?
Again, I'm part of the immunization program. I obviously like to see more people immunized. And again, I can understand people's hesitancies. They're hesitant about getting it. But I would try to encourage, and we're making it as more convenient as possible getting the booster. Like I said, we have the Northern Clinic, the Southern Clinic, the mall, the
villages,
UOG, and then we're also going out to different villages. And so we're trying to maximize and hopefully, and I think we're seeing a lot of, especially the 65 and older, getting the vaccine, the booster vaccine. So I wish it was higher, but I'm happy with what I get.
Mm-hmm.
So what do we got to do, Doc? Because we're here to help. That's one of the reasons why we set up this interview. Is we believe that we've been pretty responsible partners during this pandemic. So how can we help you guys get the word out? If you're with immunization and you say you would like to see more people get the booster by now, what do we got to do? Because we're here to help.
I think just telling people, first of all, so like a lot of our brothers from the outer islands, if once they open up, if they want to go to visit relatives out there, they need to get vaccinated if they're not vaccinated. Because over there, it's mandatory vaccinations. You can't go to CHUK, or even though they don't have COVID, it's mandatory vaccinations in those outer islands. So one of the messages, hey, if you want to go visit your relatives, you got to get vaccinated. And when I see kids in the clinic and I talk to their parents about this, a lot of them don't know about this. They think they didn't know that that's mandatory, and so they start. You can see that their brains start thinking, oh, maybe I should. So just tell different people, give them different reasons why they need to get vaccinated. I always tell my patients, I said, do you want to protect your kids? Do you want to protect your parents? Do you want to protect your grandparents? And I asked them, so what's the best way to do that? And the majority of them will respond to get vaccinated. So, just try to put out different messages and how to encourage them. And sometimes it's just as a matter, do you want to, most people on this island, most people in the outer islands, they love family. So if you put in a way that, hey, if you get the shots, you protect them, a lot of them, just think about it. And that's the first step.
Can I just ask, some people, they might not have their vaccination card. They may have lost it or misplaced it or whatever.
Mm-hmm.
Do you need to bring that, or can I, to get the booster shot?
Or you just look us up on WebIZ?
Yeah.
Well, if you go to, like I said, these clinics, they also do have somebody from immunizations that can go onto the computer and go look up on WebIZ to see if in fact they did get the vaccine and when they got the vaccine. So it's easier and faster if you have your card, but it can be done without the card.
And if it doesn't matter,
I would
right?
recommend bringing the card.
Okay. It doesn't matter if
it does matter because, like I said, it's faster, and
right.
A lot of people, they don't want to wait. But so if you want to get in and out as fast as you can, then bring your card.
Mm-hmm. And again, it doesn't matter, right, where I go to get the vax, because if I went to UOG,
Nope.
I don't have to
Nope.
go back to UOG. I can go to someplace else. Okay.
Anywhere that they offer.
Okay.
Again, most places will have the access to the WebIZ, so they can see what vaccine you got at UOG, or what vaccine you got at da-da-da, or what vaccine you got at the mall. So it doesn't matter really where you go, just go.
And it's free.
And it's free.
All right.
You know we love our free, Doc.
Well, you
And
know,
especially when it's free, it's a lot of benefits to it.
Right,
right.
yeah.
Well, you know, before we let you go, Halloween is just around the corner. I guess your message to the community.
Be safe. I mean, that's it means different to different people, but bottom line is, wear your mask, social distance, wash your hands or hand sanitizer, and get vaccinated if you're not vaccinated.
All right.
All right, Doc.
Thanks, Doc.
You're welcome, and thank you for allowing me to give my opinion.
Right. Anytime.
Yeah, anytime, Doc, at all. Middle of the night, late in the morning, we'll take you anytime we can
No,
get you.
I love my sleep.
All right. Not the only one. Thank you, Doc.
Take care.
Okay, you're
Okay.
welcome.
Okay, bye.
Okay, bye.
All right. We'll be right back after this break. Good morning.